Welcome to Joint Effort PAs, where two orthopedic surgery PAs get real about life in medicine. From tips and tricks to professional growth, work-life balance, and everything in between. We're here to share what we've learned and what we're still figuring out. Let's get into it. All right.
We're trying something new today.
Whoa.
In so many different ways.
Yes.
Crazy.
The hats were a surprise.
So we're going live with video today for Joint Effort PAs. So we'll see. The holiday edition.
This is the holiday edition.
Yes.
And I don't know that it's necessarily like a holiday topic, but...
Oh, no, it's definitely not a holiday topic.
But it is a necessary topic, so...
Yeah. So we have a special guest with us today. Our friend Alexis.
Hello.
Thank you for coming.
Yes.
So why don't you tell us a little bit about yourself, what you do in the ortho world, and how you've come to know us.
So I am a circulating nurse in the OR. I can also scrub. I have been in the OR for going on 9 years now. Majority of my experience was in eyes. I did eyes for about 6 years, and then I did a little bit of everything for about a little over a year. And I've been doing ortho, where I met you guys for about 2.5 years now.
Yeah. So you didn't do ortho other than like your little bit of everything
until I came here.
Okay.
Yeah.
So when they were like, hey, this is all ortho, were you like, yeah, no, that's cool? Perfect. Or were you like, no, that'll be challenging? Or were you like, this is a slam dunk?
I was like, this is a paycheck for sure. No, I came here because I was tired of the hospital environment, and I didn't necessarily take into account that it was only ortho. I just was like I like the OR, and then when I came here, I started doing like when I did the scope stuff and doing totals, like being a little more involved in that. I was like, this is actually pretty cool. Like I might be an ortho girly. I don't know.
So describe your schedule. Like what does your typical schedule look like when it's not like December?
Classic 5 days a week, 8-hour days. Trying to, when it's not winter, it is like sometimes during the week, you're trying to find kind of ways to get your hours, occupy your time. So what I like about this place and this environment is that there's other things to do outside of just being in the operating room. You're able to kind of get hands-on with a little more of like I do things with like handing out infection forms, and you're able to see different data points in that sense and kind of just do different administrative things that sounds terrible. But at the hospital, part of my annoyance was that I was just a drone and just a cog in the machine. And like here, I feel like I actually have a role to do outside of just being like a body to fill the room.
It's cool also to understand like what matters, so I don't even know if the hospital, if you even knew there were infection forms, so that is something that's like, a processes check that when you're in a smaller place, that's really important. So I think having your hand in that's, again, purpose. It gives you a little bit of purpose.
Do you feel like when you switched from the hospital, you came into the like outpatient setting thinking that the hours would be better, worse, the same, or like schedule wise it would be better?
Schedule wise, probably definitely better. I did know that it would just like the pay difference, just because in the hospital you tend to get a lot of differentials. Especially I worked 11 a.m. to 11 p.m. so you get that night differential and everything. But I was aware of like things where it's like, if you don't have any more cases to do in the day, you can just leave early, which in the hospital is like unheard of.
Right.
You know, like even if you're not doing anything, you're still like, there. You got to stay here and just sit in the lounge and stare at the wall, until something comes up.
Yeah.
That's tough.
Yeah. Yeah, that's tough.
Now, do you work with less surgeons here than you did at the hospital? I mean, obviously at a surgery center, it's going to be your same players, but did you have that little niche at the hospital where you were with the same surgeons, or now since just by design it's smaller, it's a smaller crop?
That's funny because since I started in eyes, it was a similar situation. It was the same surgeons I worked with over and over. because it is such a niche field. And then when I went to Rex, I definitely had a big kind of like group of doctors, like a rotation of doctors I worked with. I did tend to work with a couple of them over and over because it was one of those things where it's like, oh, you know, a lot of people don't like to work in this area. So I tend to work with those surgeons in that area just because nobody else wanted to go there.
Yeah.
But I did come across a lot more surgeons at Rex.
Yeah.
So fair to say you've been exposed to a lot of different surgeon personalities.
That is fair to say.
That's good.
And that's what we want
Yeah.
to make this topic today.
Yeah. But before we dive in, I just want to get a pulse check on everyone around the table here. So end of December, how we doing?
Oh, man.
I mean, you're smiling, so I feel like pretty good on your end.
Is it a forced smile, Alexis?
I'm smiling because it's my birthday.
I know. Yes, it is Alexis's birthday.
Yes.
Happy birthday.
But no, like if you had caught me maybe like yesterday or the other day, it's just December. I think it's summed up in this interaction I had with a group of people I was trying to hang out with outside of work. December is summed up in, hey, I know I get off at 3 p.m., guys, but I might be late for our 7 p.m. trivia.
Yeah.
Yeah.
You know?
Yeah, pretty
Yes.
much.
Yeah, that is true.
So that
Did you make
doesn't
it to-
make me happy.
Did you make it to trivia?
I did make it to trivia, but that was because circumstances happened and we didn't even have the full day. If we
Oh,
had the
yeah.
full day, I would have been late.
Yeah.
Yeah.
Or absent altogether.
Yeah.
Yeah.
Hannah, pulse check.
Yeah. We know. Yeah.
We do know.
This is
This
a rough week.
This is
struggling
mile.
collectively.
This is mile 10 on the half marathon.
Yeah.
This is when you decide if you're just going to take your shoes off and sit on the curb,
Uh-huh.
or if you're just going to keep going and deal with the rhabdo afterwards.
Yeah. Well, we don't have a choice but to deal with the rhabdo afterwards.
Yeah.
Beth's immune system has already
My immune
begun the descent.
Yeah, yeah. My right eye won't stop watering. The left side of my throat is closed. So, I mean,
And we
this
both
is,
ran
but
6
this
miles
is,
this
but this
morning.
is going right to. This is right on cue. Like
Yeah.
this is a
You're
very
about to enter your break.
very predictable pattern. So,
Yeah.
I feel like I'm on the edge of succeeding or dying.
Yeah.
Yeah.
So
well,
that's December.
that is December, especially the last week. So, I mean, fortunately, there's, well, technically kind of 2 more weeks of insanity.
I'm like a little
week and a
upset
half.
you said that because
Yeah.
in my head it's just like 3 days. But I hear
Yeah.
you.
Yeah.
I hear you, but my
But-
voice is getting shaky.
Wait, what?
Anyway, but we are all here today talking about this topic because we do what we do and we work with these surgeons and we are all here for the same successful outcome and making patients happy. But along the way, we have various characters that we have worked with.
You will encounter all
You're
of
gonna
the
encounter all
archetypes
them.
at some point in your
Yes.
life.
So today we're just going to dive through all the fun and not so fun personality traits of the old surgeon. So this will be a good one.
I'm excited.
Okay. Who wants to start?
All right. Are we starting with the professor?
Let's start with the professor.
The professor is a mild personality type. You know, this is a good beginning.
Yeah, this is maybe an older surgeon
Yeah.
or
Yeah.
someone maybe just out of fellowship who really cares about teaching.
Yeah, definitely not in the middle because
They
somewhere
don't
in the
care.
middle they lose that. And then
lose-
maybe towards the end it
Yeah.
resurfaces, I
Yeah,
guess. I don't
think
know.
So. Yeah.
Yeah, so this is somebody who loves teaching. They love taking students. They love explaining everything they're doing in detail.
Mm-hmm.
I when we were making these outlines, it said, you know, making the OR run a little bit longer. I think that may or may not be true because some people are.
That's true.
You think always?
Okay, Alexis, from a circulating nurse standpoint, when there's a student in the room and it's past 4:30 and you know that student's going to close, are you getting out at 4:45 or are you getting out at 6:15?
When I see that student, or I worked with a lot of fellows and residents, and when I see that resident take over, I very much am getting the eye twitch.
Yeah.
you
Yeah,
know?
yeah.
Yeah.
But I mean, you have to have professor surgeons because how else are people going to learn?
Yes, very
Yeah.
necessary.
Yeah.
it's just sometimes it does alter your efficiency.
Oh,
so do you have students?
We have students, but
Okay.
I take on the professor role, and
Yeah.
I try not to slow things down.
Right.
In fact, I will like teach as the surgeon's doing something, and I'll bring the volume down to here, so it's really not like interrupting anything. Yeah. And when they ask questions, I'm like, this is not the right time for a question.
Yeah.
Shut
So
up.
like so like the pre in the OR and post OR, there's a lot of pre-prep and there's a lot of debriefing afterwards. But in the moment, like we've worked with students before when my surgeon is feeling the professor like tone that day.
Yeah. Had something happen to our audio.
Okay.
So we're back.
We're back. Okay. But I think, like I said, we need the professor, but it's not, you're not going to get out before 3.
Yeah.
It's just not going to happen.
Yeah.
Yeah. And I got like a little bit of a skewed kind of area on this just because I came from a teaching hospital. So
They were all,
it was pretty much all that you had good professors and then you had terrible professors. And the thing that really drove me nuts about the surgeon personality of this professor is that you could tell the ones who were in the teaching hospital and they gave the professor role to their fellow and they would leave. So you're trying to, your resident or, whoever's there is trying to learn from this person who has all this experience, the surgeon. And then they're like, all right, cool. Here's my fellow. They'll talk to you and I'm out. And they'll leave the room, and then the fellow's kind of like also they're absorbing the knowledge of this, of this surgeon.
What? Come back.
Yeah.
They're like, okay, I just learned how to throw this stitch, but let me teach you how to throw this stitch I just learned yesterday, you know?
Does that make you in the room as the nurse, does that make you comfortable? Or are you like, who is in charge here?
Yeah.
Like, what is going on?
I've been known to like give the eye contact look as they're walking out, like complete eye contact. Like, wait,
Why are you leaving us?
it's
Like,
right
this
now?
is a bad
why
idea.
are you, why are you doing that? This is the last, and this is the last surgery of the day, and then like that is where you just demoralize your whole room when you do that.
Yeah.
Mm-hmm.
Have you ever been in the room with a professor that is talking just so the room hears? Like, it's not really done to educate, it's done to just show off their knowledge.
100%.
And when it's happening too.
Yeah.
Yeah.
You do. Because then they don't only look at who they're teaching. Like, why are you looking over at me as a circulator?
Yeah.
Like, right? Like,
You're like,
are you getting this over at your computer over there?
Yeah, no, totally. Yeah.
I don't care.
So, all right, moving on.
Ooh, Beth, I feel like you should introduce this next one.
The cowboy?
Yeah.
Okay. So the cowboy. The cowboy is the fast, efficient, confident surgeon. So minimal talking, maximum effort, like just going in, super mechanical and good.
Yeah.
So not that it is a rush situation, but it is I am here for this. I'm going to be tactical, get in, get out. And, the room nurse is kind of like, I barely opened shit up. And now we're done.
What are we doing here?
What's going on? Yeah. And the anesthesiologist is like, did we start? Because we're done. Yeah. Like, it's one of those. And that surgeon, being a PA at least, working with that surgeon, you need to know every move. Like, when I was younger and playing Nintendo, like with someone else playing and you got your controller there, that is literally how it goes.
Yeah.
You know what they're going to do, and you're like sliding in to do every step right when they need it. So when they put their hand down, before they reach for the next thing, you have the next thing there. So it requires maximum focus and energy to do that.
Yes.
So have you guys experienced that surgeon?
Oh, 100%.
I feel like you have.
I have. I've lived with that surgeon
For a long time.
Yeah.
Yeah.
But that's not just the surgeon I work
Right.
with. There is so many overlaps between the next stuff we'll talk about.
I know. It's wild.
Yeah, but I think there's a lot of respect for that surgeon who is just there. Like, for example, the case is posted for 45 minutes. Everyone at the facility knows that's not going over 45 minutes.
Yeah.
Like, this day
It's a
is
beautiful
going to
thing.
run on time. Yeah. We post 8 cases. We're going to be done on time just because that's just how it goes. So the cowboy, just to be clear, is not cocky. They're just there doing it fast and efficiently.
Yeah.
And they get a good reputation for that, I think.
Yes. Because they're doing it fast and efficient. They're not talking about how fast and efficient they are, because then they become one of these other personality types, and they're not fast and efficient.
Then the lines get shady, and then, but not to, give any spoiler alerts, but when the cowboy is on time and rolling and the vibe is there, and then someone introduces on purpose or accidentally inefficiency, they turn into somebody else. So
surgeons are like gremlins.
Oh, it is a total gremlin situation.
Yes.
So
don't feed them after midnight. Is that the rule?
Well, don't feed them after midnight, but don't feed them when they're firing on all cylinders.
Yeah.
Like, you don't need to add anything. In fact, walk away.
It's like best like just be quiet. Like they're blowing up, they're going off, but nothing needs to be said. Yeah, let them get it out.
Let them do it. Yeah.
It's a good
that vibe.
So the cowboy or the sheriff.
The sheriff. Well, the cowboy and the sheriff have
the same. They're like the same.
Yeah.
I'm picturing Toy Story right now, but whatever. It's the same.
It is. Yeah.
So I love working with the cowboy. It doesn't allow for like small talk when it's like tuned in on zone, on the zone. But sometimes the cowboy can loosen up a little bit and add in a little bit of fun. But if you're misreading the situation, you think it's a fun time and it's not a fun time,
you're in trouble.
The cowboy turns into something else.
Oh, yeah.
And it's funny. I feel like that lightheartedness of the cowboy always comes like at the very end of everything. Like maybe you're closing or something. It's the very end of everything.
Yeah.
But then everybody else is in an uproar and panic. I haven't finished charting.
Yeah.
Anesthesia is like I paralyze the patient. Like you're
like,
done. You know.
Yeah.
And then the cowboy's like, oh yeah, everybody's like, oh he's like,
so I'll be back in 10 when you guys are turned over.
And I'm like,
wait, what? Yeah.
Yeah. No, that it's funny because that personality type I feel like it's great, but it can lead to chaos.
Yeah.
If it's not communicated appropriately that like we're all in cowboy mode today.
Yeah. Do you feel like maybe we all need to like have a morning huddle? What personality, what mood are we today? What vibe are we?
So I will tell the OR if there's an unexpected vibe.
Right.
Like I will say something like, hey, we're going to be a little different today.
Yeah.
I feel like it's
a good warning.
Appreciated, right?
Yeah, 100%.
Yeah.
Or sometimes it's just noticed.
Yeah. Oh,
the number of times Alexis comes up to me and is like, dude, what's going on today?
Yeah, I'm like, the vibes are off.
Yeah, something's going on.
Are we fighting somebody? Or?
Yeah.
She's like, tell me where to be.
I'm ready.
Yeah, I'm right here.
Oh my gosh. Now let's combat that to the super chill, super laid back surgeon.
Yes, the chill wizard.
The chill
is
wizard.
What we call them here.
Yeah.
Alexis, have you worked with a chill wizard?
I have. They tend to be like more like kind of my favorite, but I've found that the chill wizard actually is the person who posts their case times properly. And
so they're self-aware.
They are. And it's like, I think I really appreciate that in them because they like know, all right, I could do this in this amount of time, but they're also kind of like, in the sense they can be a little meticulous.
Yeah.
And I, for some reason, have kind of found that in like foot and ankle surgeons.
Okay.
So even like at my other hospital and stuff I worked at, it's tended to be like the foot and ankle people are like, they're chill, but they're also like meticulous, but they also post their times kind of appropriately. It's weird.
Yeah, I feel like that's self-aware. Right?
Yeah. I hear Alexis saying that she really likes working with foot and ankle surgeons.
Yeah. So I think that aligns a bit with your personality.
Yeah.
So you are also a bit of a chill wizard.
Yeah, very much so.
Yes, I would agree with that.
But I feel like the chill wizard stresses me out because I'm like, don't we want to
like let's go
faster? Not that faster is better, but I just think like again, if I'm geared up and then it's like super reserved, even like decision making sometimes is like and you're like, oh my god, like just do it. Yeah,
we're gonna choose right now.
Yeah, so I misconstrue chill wizard with indecision sometimes.
Yeah.
So not that equals that, but in my perception,
right,
that's what
it's
I
just
see.
not. as much what you're used to.
It's not what I'm
Also,
used to.
like as a PA, I think there's a lot more satisfaction that comes with the cowboy type.
Yes.
Because that is a more satisfying day to me, being able to do the predicting, mind reading aspect of things and like thinking 5 steps ahead.
Yes.
I enjoy that. Whereas like I'm not there to just like chill.
Well, that's
you
the
know?
thing. Well, that's the thing. So the cowboy is going to drink a shot of espresso, and the chill wizard is going to sip his coffee.
Yeah.
Like it's a very different
And
personality.
you're like, we've been
thing.
in here for 10 minutes. Where are you?
Where are you? Yeah.
But I will say that if I like working wise, like I like the cowboy days because I also like, you know, like my mind being like, all right, this is next, blah, blah, blah. Like, and my day goes faster. But if I know I'm working with the chill wizard this day, like what I don't like is when I have a cowboy for the first half of the day and then I get the chill wizard.
Yeah, and you got to switch gears.
And then I got to switch gears. Like that throws me off so bad. And I'm like, oh, wizard.
So is the music selection for the chill wizard different than the cowboy? Or can that overlap?
I actually feel like it's more of like the surgeon in that sense. Like, because I've had some music with like the chill wizard that is not necessarily my favorite, like 80s or something, but that can also be the cowboy listens to 80s. I don't feel, but I feel like the cowboy doesn't listen to the music, but they definitely know when you play something that's off. Like if they like the 80s,
it's a vibe.
Yeah, like they're playing the 80s, like, but they're not really listening. But then like if I played like 2000s, 2010s, like, whoa, what is this?
Yeah.
Whereas like the chill wizard, like no, like they're like vibing with each and every song.
Yeah.
Side note, sometimes Alexis likes to give me whiplash, multiple personality disorder with the playlist.
But but again, I think that is the personality coming into the room right there.
Yeah, it's a lot. I'm like up here, we're vibing, we're dancing, and then all of a sudden I'm like, I have to cry.
Yeah, I get you.
Be right back.
Outside of nursing, actually, I'm known as like a DJ. Like that's my circulating role as the DJ.
Yeah, I mean you're in the right place.
Yeah.
Oh my god, it's happening.
It's happening.
It was destined to happen. I bought a new speaker today, so
Nice.
yeah, I'm excited for that. Then we have the technician next.
Yeah, I think this can also go with the perfectionist.
Yes.
Yeah,
on
I think
par.
we can
Very
overlap
similar.
those.
Yeah.
Yeah. So the technician is precise, almost like obsessed about perfection, right?
Yes.
Which again, do we think that's a bad thing?
Not necessarily for a surgeon. I mean, I think the part that becomes negative about it is when those perfectionist tendencies bleed out into other areas of life, right? Because you're not a perfectionist just with your surgery. You're going to be a perfectionist about everything.
Yeah, well,
you have to be. I mean, it's your personality type.
Yeah,
you can't.
well,
you got to take the good with the bad.
Yeah, like it's the lights are in the right. They have to be in the right side. The temperature in the room.
Like this is a little. I don't know. The trash is sitting in a weird place.
off,
I don't know.
yeah.
Everything, anything.
Yeah, yeah. The drapes aren't like exactly where they need to be, and then like shit hits the fan.
Yeah. Or
Yeah.
like God forbid, like for some reason, like the like for some reason they changed the colors of like the needles. So like a 25 gauge was blue
Yeah.
Oh,
at one
God.
point, and then it was
it's orange,
orange,
yeah.
and then like threw the perfectionist off. Like I literally had to show them the package. Like did not believe me.
Wait,
Could
so
not like short circuited.
did you attempt to tell the perfectionist that they were wrong?
It was highly.
Well, it sounded like you
stupid on my part.
suggested that they might not be right.
Yeah,
I don't think it was that they were wrong.
But I was like, they were like, no, I needed a 25, and I'm like,
That go
this
for you.
is a 25, and they're like, no,
So do you then go get the right color, even though it's the same needle?
I 100% had to do that. I had to show them both, because we had both at the time. Like I had the blue and I had the orange, and I was like, you see this blue, orange, flip the packet over, 25. He was like, I don't know why. He's like, why did they do that? I was like, I don't know why they did that.
Yeah,
sorry.
like
I
one
know-
was
I know.
cheaper.
Yeah,
I
I'm
don't
sorry
know.
for that.
I have no answers. I can call the manufacturer if you really need me to.
So do you think there is such a thing as a perfectionist that has like is super understanding, or are all perfectionists like short fused?
They short fuse they will all
They, like,
short
break
fuse
down.
at first.
Yeah.
Yeah.
Then depending on the personality of them, some of them will come back and say, all right, that
This
was
was
a 25.
ridiculous.
I'm
This was
sorry,
ridiculous.
that
I'm
wasn't.
sorry.
And then other ones will just come back, won't say anything, but then also won't like short circuit when you give them that orange 25 again.
Yeah.
Like they don't apologize, but they're kind of like, all right, I'm not gonna freak out again.
But it's so like robotic though too. It's almost like they live in such straight lanes that if you happen to show them an orange needle that is supposed to be a blue needle, it's like you can kind of see it happening.
Yeah.
You know what I mean?
And I'm like I'm actively preparing myself. I'm like, all right, yeah, you're gonna lose it on me right now.
Yeah, like I have ice packs. I'll throw them in your pits whenever it happens. Whenever you need
What do
it.
we gotta
like,
do
ready
here?
to go. Yeah.
But it's for some reason like those are kind of like my favorite. I find that like the perfectionist, like I don't know what it is. I gravitate towards them, and I think I like the consistency.
Yeah,
I like knowing that if I set this table up like this, that perfectionist will love me for the rest of their
they're
life
happy.
because it's easy to learn them, and it's easy to set
Mm-hmm.
everything out the way they like, and then I become their number one.
Yeah, until they decide to change their minds randomly one day, and you're like, "Wait, you did this the
I
same
know.
way."
So I haven't run into that.
The perfectionist always keeps their scrub top tucked in. Yes.
I mean,
They do. I'm not wrong.
They do.
I'm trying
Or
to go through in
something
my mind
tucked
who
in.
does versus doesn't keep their.
I know,
scrub
but like
top
a
tucked in.
disheveled situation
Yeah.
is not
Yeah.
the
Is not
Right.
The perfectionist also doesn't really sweat grossly. Like they'll sweat, like they'll glisten because they're working hard, but they don't sweat like some surgeons soak themselves.
Right.
I would even go so far as to say they're usually the ones who are cold. If I'm being honest.
I mean, I totally think you're right.
Yeah, they have their
were trying to be
undershirt.
nice.
Their undershirt
Yeah.
is also tucked in. Like they
Oh,
have
they're-
their whole
well,
clothing under.
But
their
they
scrubs.
also have an undershirt.
Yeah.
Like perfectionists have undershirts.
Every time.
You know, the other ones don't.
Wow.
Yeah.
The chill
So-
wizard never has an undershirt.
Why?
Never.
Literally never.
Why would
Yeah.
you need
In
that?
fact, the
Disheveled.
top is probably not the same size as the bottom because whatever, it was there, right?
yeah.
And it's crazy
It's
because
fine.
one part of the Cowboys thing will be tucked
Oh yeah.
to make it look even more obnoxiously like crazy.
Yeah.
Like why did you tuck only this one?
Well,
corner
because-
of your shirt?
Like a
because
front tuck?
getting dressed was all about I just gotta put clothes on. Like it wasn't about I need to look a certain way. Like the job is to put clothes on. I did it. This is what you get. Right?
This is what you get.
This is what you get.
A
Yeah.
front tuck is trendy, or
So-
it was.
It was. That's
It
right.
was.
I don't
So
know.
you'll never hear the perfectionist say, "It's good enough for government work." I mean, that's true,
Never,
right?
never,
Yeah.
never in my life have I heard that except
When
once.
I did. Except when I did.
Except for the one time I did, and shocked to say the least. But
So how's the perfectionist with fluoro? Like, how many pictures do you take?
yeah,
Right.
I'm irradiated.
Yeah, you're right.
I'm
right. Like, if you
glowing.
don't have lead and you're in the room with a perfectionist,
Right.
you have cancer.
And that was I do. That was like the other dichotomy between situation X and Y. I was like, wow, I think we took 3 X-rays. Like, are we gonna take more?
Yeah.
I
was
also
Well, the cowboy takes 3 X-rays, AP lateral, done.
yeah, done.
This
That's
is
it.
this is where I needed it to be.
And I'm like, is that a little blurry? Are you sure
Is
you
it
want to
fine?
save it?
Sure.
Looks good.
No, you need glasses. That's the issue.
What I also so about the perfectionist, what I also find funny is like, you can tell like when things like I always say they have about a 3 question max.
Oh,
They have
yes.
about a 3 question max, and then you're like, but what I find funny is sometimes with the patient, I'm looking and the patient does one thing and their eye twitches, and I'm like, ooh, patient, don't do anything
Like when they
else.
have
No.
involuntary motions, you mean
Yeah.
like if they're not
sedated
enough,
like especially
or-
like if they're not sedated enough, like especially like so a professional I worked with was in eyes, and like there's a very fine sedation between with anesthesia, like doing eye surgery and everything, and it was like a little head twitch, it's like one head twitch is like all right, cool, second head twitch, you definitely like you see the movement, when you see the movement, you're like, oh, the tensity come, and then when you hear the
on the surgeon's part.
on
When
the surgeon's part,
so they have
on
to
the
like
surgeon's part.
they have to somehow calm themselves.
Yeah.
Even though they're cold,
Even though they're cold,
they're getting hot.
They're
Yeah.
getting like, and then they do the shoulder, and then when you hear like the intake of the breath, you're like, patient, you got one more of those until
What about when they add the neck crackling?
yeah, and
Then
and
you're
then I'm
done.
like,
We're done.
ooh, and then it's usually like a quick little stop moving, or like stop, and then
Yeah.
like
and
that
then we're done.
that-
Yeah.
and it's like that was what they built up this
Yes.
whole time, and it's like one word, but the word is piercing. You
Yes.
know?
Yeah. Like everyone in the room is like, yeah. Yeah.
Sure thing.
That's crazy.
Oh my god.
So let's go to another fun one. How about everyone's friend? Like, who's that one? This is the one that likes to be cool, likes to be the most well-liked guy. Like, we can't bring the patient back because they're doing fantasy football with, you know, the anesthesiologist, or they're ordering lunch for everybody. And they're just there. I mean, they're there for the work, but they're also there to be liked by everyone.
Yes.
So what do we
absolutely.
think about that?
I feel bad in saying, like, because, you know, they're usually cool people, but like, to me, in my mind, and especially like in the OR, we're moving. I'm like, I'm gonna stand out here and I'm gonna let you say a couple words, and then I'm like, we gotta go.
Yeah.
Like, we gotta move.
So whose job is it to get that person? Because I would say that person is on this story. Guys, my eyes.
Yeah, I just noticed. I was
My
like,
eyes
a
watering,
lot
like,
is happening right
watering.
now.
A lot's happening right now. So you'll get
He's really emotional about this.
No, it's not. It's my immune system.
Is
Like, I'm gonna start sneezing any second.
I love that
Feel free.
this
No.
is the video one we're doing.
I
while
know.
we're
I need
crashing.
I was this close to bringing sunglasses in case this started to happen. But here we are.
I think
Anyway.
it's adding to the.
No, it's adding.
Yeah.
No, but like, whose job is it to get them back on track? Like, okay.
Alexis's
So let's
job.
say we have everybody's friend. It's the cool guy, and then like literally dying. And then you have the PA. Is it the PA's job to like center them,
Yes.
or someone's
Yeah.
job,
Yes,
right? Like,
yes.
it's someone's job to bring them back in.
When this is just my personality. I don't mind being that person.
Yeah.
Because there have been times where the fellow or the PA are also jokey people.
Yeah.
Or they're just used to that, you know, them being like that. And so I, like, in my personality, I'm like the one, because they usually do well with me being like, we're done here. You are about to operate now.
Yeah.
Like,
Yeah.
you know,
Yeah.
like.
All right, time out.
Yeah, like, so I take it upon myself, but then you have other, you know, circulators and other people who are like, that's just not my job. It's not my job to wrangle them. It's not my job to do this. But I'm like, at the end of the day, if you want to go home or if you want this to happen or that to happen, I'm going to make it happen.
Yeah, in an outpatient setting, it is your job. Like, if the day doesn't, you know, run smoothly, like, everybody's mad. Everyone's in overtime. These people have to stay late. Like, it's a whole thing.
It'll come back to being blamed on you somehow. You know, they'll be like, God, why were we so behind today? Turnovers must have been shit.
Yeah, but then,
Right?
but then,
And you're like,
at,
no, you
you're like,
talked.
no.
yeah, but then at like a social gathering, everyone's like, "Oh, that guy's so cool," and you're
Yeah.
like, "Yeah, like
Sure.
socially, yes, but like sometimes, like in
Yeah.
the OR, no, right?"
I think it also just has to, because we can all appreciate that personality type. I love to vibe and hang out. Great. Wonderful. But when the mood switches very immediately without warning,
Yeah.
or when it's like a Jekyll and Hyde situation, you know, I don't know.
Yeah.
You're just supposed to adjust. Like, I mean, there will be Jekyll and Hyde, and again, I mean, God, we'll talk about that.
Yeah.
What's happening to your
It's-
antlers?
Cover my eyes.
I mean, they can. You can
Literally-
put the moose
literally
head
dying
down in front of
to
you.
wipe my eye.
That's what that was for.
It was what it was for.
But yeah.
But I think you have to redirect that person. I think, like, you let them go. Like, you let them vibe. You let them tell their jokes.
Yeah.
You laugh at them because they're kind of funny. But,
Yeah,
like, you're
we
kind of
like the
annoyed because
jokes.
it's kind of, like, not-
Yeah, you like direct them to air, like, they're really bad at the walk and talk. And so it's like you redirect them once you get them to the area. So like if they're not in the OR, I will get them to the OR and then listen to their story still while we're positioning.
You have to be able to use
while
your
we're
hands
doing
while
this.
you're talking, though. We
Yeah.
can't stop.
Yeah.
So it's like, you know, like, okay, like I've herded you. I've herded you into the OR now.
Yeah.
Like, what was that story you wanted to talk about? What was that story you wanted to tell, you know? But then, like, during the case, you got to pick and choose the times where you are going to laugh or you're going to do something, because then they start talking to you with their hands.
Yeah,
you know?
but,
like,
but if you
gotta-
don't laugh, they try harder.
Yeah.
And then they stop what they're doing to, like, get your attention. So then
Yes.
you're like,
Exactly.
Like you do that, and then you're like, I just did that for everyone here.
Everyone.
I did that for you.
Yeah. Yeah.
Yeah.
Now we've accomplished what we needed to, and we can move on.
Yes.
So I think that transitions perfectly into the yeller, or into the blackout surgeon. Let's talk about that.
The blackout?
Oh yeah. So
that?
the yeller is someone who just has a boisterous personality, is always the loudest person, usually is a big dude, right? Unless you've got the whole Napoleon situation, which I haven't run into. I don't know if you guys have.
I'm sure you had to have at some point, right?
No. I have with administration, but not
Yeah,
really
in
surgeon.
life, yes. Surgeon, maybe not.
Yeah, surgeon, no, but the administration, yes.
Yeah, so the yeller is like, I think, like, has the shortest fuse. So, like, constantly stressed out, defines himself as passionate to, like, substantiate the fact that they're yelling all the damn time. Yeah. So, like, if you're not, you want to be handed an instrument and you don't get it on the first try, then they're yelling at you, right? So, I think people react differently to yellers. I think if you know that someone is like a yeller and they just ask for everything so aggressively, you're kind of like, all right, that's just them.
Yeah.
But if you have like the blackout yeller, that's the one that is fine. Like that's like acting fine. Day is going fine. It's the perfectionist. Maybe it's, the chill dude, the chill wizard. And then they go into this tirade and it's almost like they blacked out during the tirade because then they revert back to their personality.
Yeah. And you're like, what just happened?
Yeah.
How am I supposed to act? I don't know.
Yeah. So have you guys been in a situation with a yeller?
Yes.
Yeah.
And
100%.
I mean, number one advice is you can't take it personal. It's literally just noise. It's like when someone's blowing their leaves on a Saturday. Like it can't be any less loud.
Do you ever have to make yourself not laugh in those situations because it's almost humorous?
Oh yeah. Like it's like a dissociation almost. Where you're like, there's no way this person is going to continue at this volume and everything, like yelling like suction, like okay, I heard.
I'm laughing thinking about it.
But I heard you, right? Like, I mean, it's just insane.
God forbid I'm in a toga because I do not control my face.
Yeah.
Yeah. Like when you're wearing a toga, like if people can see like your full face, you're not wearing a mask. So.
But don't you think though, instead of, laughing is one way to deal, but don't you think sometimes a way to deal is to like meet that energy? Like I think
and yell back at them.
Sometimes that's hard.
Yeah.
I know surgeon PA teams that the yelling triggers the other one to yell. And then it's like
yelling back and forth.
Yeah. I mean, you've been in those rooms. I know you have.
Yeah. Alexis has seen it firsthand.
My parents are fighting. I don't know. I just stand here.
Seriously, you just stand there and you're like, I guess I'll wait till it's over.
Do you have to take sides? Like,
do I have to? I mean, so if you know what's good for you, always takes a certain side.
Yeah.
I mean, it's the whole classic, like, if the surgeon and the assistant comes in, always gown the surgeon first, glove the surgeon first. It just makes your life easier because you and the PA or the assistant, after the surgeon's gone, will look at each other and be like,
what the F?
That was extra.
Oh my God, that was stupid.
Yeah. But I think the yeller makes everyone on edge.
Yes.
And I think if you know and expect it, not that it's easier and we can all handle it, but I think it just makes everybody on edge. Like, God forbid you have a question about like, hey, your next patient. No, that is not, you do not ask that. You do not ask that.
And PACU always wants to call in those moments.
Always wants to call in those moments.
I was going to say, like, the moments where it's like in the heat, mid-yell session, and something else in pre-op PACU is going awry, and like you have to ask like you take the phone call and you have to then say that in the middle of this. You're like, hey.
No, I'll do this. I'll do this in the back. I'm like, no, now is not the right time. Because that's when you get a call and they're like, hey, they don't have a prescription for moderate pain.
Always about the prescription or the pharmacy. What pharmacy it needs to be sent to.
Yeah. And the best part is when you take the phone call and the surgeon's like, Jesus fucking Christ, if I have to call back you one more time. And you're like, hey, he said CVS on Capitol. Because they can hear the yeller. Like, everyone can hear the yeller. You don't even need a phone to hear him. But that's something.
Beth, are you ever the yeller yourself?
In the OR, no. In life, 100%. Yeah, I do. I yell a lot. Like, I do. Like, I do. But then I don't like blackout yell. Like I know what's happening. And then afterwards I'm like, oh yeah, I'm so sorry. But I do come from an Italian family, and that's kind of like how we communicate.
Yeah. That's fair.
But I think like low, calm responses is the way to go. Or the yeller.
100%.
Like let the yeller yell. Right?
Yeah.
Yeah, you can't really energy match that, or it'll
Yeah.
just keep like building.
Yes.
Where does it end?
It does. Yeah. No. And when the yeller's in a toga, so good. It's like confined, but it's not. It's
But
like
it's
seeping
not.
out all the pores.
Like,
You still hear it louder, but like, are you fogging? Because
Yeah.
you're
Yeah,
yelling
like,
so much.
I
Yeah.
can see your breath
Yeah.
hitting the.
Yeah.
I just see your anger hitting the
So
screen
good.
on
It's
the toga.
palpable. It's
so good.
And like the active shaking. Like
Yes.
Like, whoa.
yes.
you're like, what is happening to you?
Yes.
Oh, the throwing of things. I love it. I love
Yeah.
it.
But
Here
the
for it.
blackout person is always the one that
The blackout is
The-
not expected.
is
That's
not-
why.
and
it's-
that's the one that makes everything uncomfortable.
Yeah.
The yeller
Oh.
is a yeller, and
You
you,
know
kind
it.
of get
Yeah.
but the
Yeah.
the blackout that's the
Yeah, the blackout yeller
mood
is
killer.
it comes out of nowhere, and I will almost like call it the crop duster. They come out and they just explode, and the field of crops around them shrivel and die, and then they come off of whatever just happened and they return back like, hey,
What's
that's a
up,
great,
everybody?
That's a great song, and you're literally like dead,
Yeah.
like knockout.
Yeah.
It's
Like, we can't recover from
it's
this.
Silent.
It's hard to recover from
And
that.
then they like make a joke, and I'm just like, I'm like, wait, I'm like, if
We're not
if
there.
nobody laughs or makes a noise, I think I will kind of giggle but like, you killed it, dude.
Yeah, but
Killed
we
the
should punish you by
vibe.
not laughing,
I
but
know.
I'm afraid it will lead to another blackout moment.
Yeah.
So we'll all like,
Or like when you don't know like if it is a serious or an unserious comment. I've experienced
Yeah.
that
or
a
when
couple
you're
of times.
or when you're in the first 30 seconds of the blackout and you don't know what's going into blackout. So
yes,
kind
yeah,
of
you
like,
think it's still a
you're
joke.
kind of like joking, and then you immediately stop. Yeah, it's almost like, I mean, it's like you slam on the brakes and you're just like,
Whiplash.
But then that guy who doesn't stop, and then they get the brunt of it
Oh,
because
yeah.
they didn't read the room.
they didn't read the
Yeah.
room, and you can't tell them because we all have masks on.
Yeah.
You're trying to.
You're
You're just like making eye
to.
contact, but
like,
yeah. And then that's when they ask like 3-question limit.
yeah.
Dude, you just asked a
Oh.
fourth question. Like,
Fourth question.
yeah. And
we're
that's the
done.
one you check on later. You okay?
You good?
You good?
Man.
Ugh.
Have we run out of personality types? I
No,
mean, we
I-
haven't in general.
We haven't, but I think those are really.
Those are they're the main players,
main
I
ones.
feel.
What about?
However, there's overlap.
There's overlap. Do we want to get into some pictures?
Pictures?
Ooh, pictures.
Yes, I brought my
Yes.
whiteboard today for this exact moment.
This is a visual aid to
So-
describe the overlap that exists.
Right. So we have some hybrids. We're going to call
Yes.
this the hybrid series here. So what about the chill wizard? Okay.
Okay. Yep. We have the chill
Who
wizard.
then goes into serious like perfection mode. Okay.
Yep.
So he turns into a perfectionist.
And those can coexist pretty well.
Yeah. So your chill wizard somehow becomes a perfectionist, and that leads into a new form
Uh huh.
of the chill perfectionist.
Okay.
Okay.
We've morphed.
Yeah.
It's an
So
evolution.
It is an evolution. So what do we think about this guy?
The chill perfectionist. Good guy.
He's a
you
good
know?
guy.
Yeah.
He's
Yeah.
a good guy,
What a good
right?
guy.
But
Or she.
he or she. But also, what I think happens is that you realize that the chill guy has some like boundaries and limits, and then turns into the chill perfectionist, and that very quickly turns into the unexpected blackout.
Yeah.
Yes. Yes. Because something.
God.
Can you spell?
I can't.
It's
I
the
can't see
eye.
it because my eye is
She's
watering.
blind.
And half the throat is
So
closed.
then you get the
Something
unex-
happened
but-
to throw off their type A. Like
Yeah.
the thing with the paper wasn't in the right spot.
Yes.
Table.
Yeah,
Yeah.
because normally they don't care until they do care.
Mhm.
It's in the wrong spot. You get the unexpected blackout, and then everyone in the room is like deer in the headlights,
Yeah.
not sure what happens. And when they come back down, they're back here again. And
They're
then we
back,
all have to just adjust.
Yeah.
But the problem is that we know they're capable of this.
Yes. Every surgeon I've ever interacted with is capable of this
The full
wheel
circle.
of spectrum of all of these.
Yeah.
Yes.
Yeah. And you always see it when like something starts to go a little bit awry.
Yeah.
They are chill. They can keep their calm under pressure, but it's like when it was so routine and then something threw them off, and then that's when their eyes start switching because they know their rest of their day is going to get thrown off.
Yeah.
And they've been so accurate with their times.
Yeah.
And then they like but then they're so perfectionist with it. And then like say like something happens, like they ask for something and like you didn't have it open because this was just a routine, blah, blah, blah. And then they like lose it.
Yeah.
And you're like, whoa.
The real dichotomy is like when this happens to someone who it's reasonable versus unreasonable.
Yes.
Because
Yes.
it can happen with this being here instead of here.
Yes.
And so there's that person. And then there's, I consider myself fortunate, who I work with mostly. It has to get to a level high enough where I am already angry too.
Yeah.
Like I expected that cycle to occur 5 minutes ago, and it was repressed for a very appropriate amount of time, and I expect it coming.
Okay. Now, what if you have the yeller? Okay. Well,
Old yeller,
The yeller is going to take up more space, right?
big personality.
So what if we have the yeller that also is equally a diva, and that overlap of the two of them, this space right in here, is the yeller, but always yells about themselves, and that equals the narcissist.
Narcissist.
So let's talk about that. So the diva is the one that needs the music, a certain playlist. Like it doesn't matter who's in the room. They just like need that. They need,
The temperature.
They need the temperature. They need their stool rolled in underneath them. They forgot boots, so they need someone to dress them like they're Cinderella to put their boots on, right?
Yep.
But they're also the yeller. So when it is a yeller that is worried about themselves personally, it bleeds narcissist.
Yeah.
So that like makes my teeth hurt. Like I don't like that.
Teeth hurt.
Like I don't like that.
Who does?
Yeah.
Who does? I mean,
'Cause
the
it's
only
very-
thing I like about those is I get to come home with good stories, and like I'm amused at the end of the day.
Yeah.
Yeah.
Because
Wow,
like,
what happened?
I can't even like process
Yeah.
what just happened.
But-
I almost feel like I don't have to. I always want to do a good job, but like, does it even matter what my performance was like? Because it will never be enough.
No, it doesn't matter because it was never about you.
Yeah.
It was
Yeah.
never about you. Like you were there to make them better, but they will never give you credit because they are good enough themselves.
But they will blame me
And
when it's not.
always your fault though.
Yeah.
Yeah. Because they're never wrong.
Yeah.
Yeah. So what is most interesting about this is that the narcissist is the one that is the most troubled.
Oh,
Yes.
So they are the injured bird.
Oh, I
They
know.
are. So
And
at
you
the end
you
of
see
the
that.
day,
Yeah.
okay? At the end of the day, like I'm okay with this. I'm okay with this, but when they overlap, it gets to like high level of annoyance. But at the end of the day, we feel bad for them.
You do. You
Yeah.
do. You are so demoralized. You're so beaten down and you're so pissed. And then you see them sulking and you're like, oh
You're
my
like, you know what?
God.
Your dad still doesn't love you.
Yeah. Or they like say the most off the wall. Yeah.
Like
Almost off the wall
Yeah,
sad
or
stuff.
like-
And you're like, oh my God.
yeah, like there's something deep. There's something inside of you that is
That
causing all of this.
Yeah.
And
yeah.
then you give them that benefit of the doubt until they,
Say
until the
something.
cycle happens again.
Yeah.
Right.
Well, then you try to appeal to this when you're like, hey, listen, like that, I just want to let you know, like that was totally my fault. And they're like, you're goddamn right, it was your fault. And you're
Yeah.
like, okay.
And you're like, all right, we're
all
back.
we're back.
And then
we're
we're back.
Yeah.
I tried to like appeal to
No,
them, but
it's like
we
a
weren't in that
small-
moment.
No,
for
it's
you
like
to-
when the door opens, there's like a crack of light. You're like, oh, I see it. And then you go to check on it. And then you're like, nah, it was dumb.
An egg on my face. I shouldn't have tried.
Yeah, it was dumb.
Wow. I
That's
just,
I mean, that's all I got.
That's some great overlap. Now, I would like any and all of these personalities will and do overlap, and it
They
can
do.
all happen in the same day in an hour.
Oh,
I've seen it happen in an hour.
Yeah, and sometimes you just don't know it yet, because sometimes the cowboy is the everybody's friend, right? So sometimes, you're expecting this, but you get that. So, the good thing about being accessory to this is you're there, and you get to be the chameleon, and you're like, oh, we're doing this. No, we're doing that.
Yeah.
No, I'm going to ask a question. No, I'm not going to ask a question. Oh, we have a student today. You're going to teach? No, I guess I'm going to teach now. So I think you have to be adaptable. You have to be adaptable. Yeah.
And that's like, I will say, like I gravitate towards like the perfections and stuff. But like you also, I mean, one of the like surgeons I've worked with, I loved him, but very highly quoted saying, they had to build lunch into his block time because we were so short staffed, and love the guy, but definitely went, they need to eat.
Yeah. Like,
why do they need to eat lunch?
Yeah.
And then it's like, and I had a good relationship with him, like pull him to the side, like, hey, did you hear what you just said? Do you understand why that was ridiculous?
Yeah.
But then they go to that other like personality of like the chill wizard, and they're like, oh, I did that thing, didn't I? My eye twitched like when it, and so it's like, but that's that like surgeon, like I will go to bat for you, like I will have everything laid out ready on that prep table that you want. I'll have all that going. But then you have like the yeller diva and everything. It's like, I know exactly what you want going on. Yeah. But guess what's not going to be laid out on that prep table for you?
Yes. Yes. Yes.
Alexis, what about somebody who needs a morale boost?
Oh, yeah. Then you have the criers.
The criers.
Oh, yeah. Let's end on that one. I didn't think it existed until you talked about it earlier.
It wasn't on my list to bring up.
Like even Chat GPT was like, it's not a thing.
Yeah. I know. Yeah. You have the criers. The ones in the case where like I've had them turn to me, hey, do you think that this is this, you think this is the right way to go? Do you think I should put this in there? Do you think? And I'm like, whoa.
Yeah.
I have a 4-year BSN. And then they're like you have to kind of like like, hey, like that's great, like you can do this, like go ahead and do that. And then you have the ones that like inconsolable. Like I've had a surgeon, I've literally like breakdown middle of the case, like I don't know, I can't do this, I don't know what's happening. Hey, call my wife. Excuse me?
Yeah.
And I look at my scrub, I'm like, he's kidding. Is he kidding?
This is a joke.
He's kidding.
No, he's definitely
my
not
scrub's
kidding.
my scrub's like, no, he's not kidding at all. Like, pick up that phone. Like, put the wife on speaker. Like, hey, babe, you can do this. You got this. You can do this. Wow. Believe in yourself.
I can't, like, I said, like, when I've said this before, when I come home and my family's like, how was your day? And I was like, it was good. Like, those stories, I just I put them somewhere.
Yeah.
Because
I don't know where they exist. Me and Alexis were talking about this. I was like, we need to think about all of the ridiculous things that have ever been said in the OR. And I mean, so many things. And I was like, where are they in my mind?
They're there.
I put them, I locked them away in a deep place.
Yeah.
And I don't know where to find it now.
Yeah. But even if I have the conversation with my family and they don't have like the reaction of like, what? No way. I'm like, you don't get it. Like,
yeah.
You
Like,
don't get it. And then I stop and I'm like, I'll save that for somebody else.
Have you ever told somebody a story where you're like, oh my gosh, insane, outlandish, and then the other person like almost sides with the crazy person in the story, and they're like, well, maybe they were having a bad day, and I'm like,
yeah,
come on,
yeah, we're done talking.
I was having a bad day, okay?
Yeah, I'm right. Yeah, no, we're done.
Why was that ridiculous? Like, maybe his wife like really what?
Yeah, maybe his wife is the backbone of the relationship.
Like, no, like not in the OR. They're human too, and you're like,
absolutely not.
What? Am I the asshole?
Yeah,
maybe.
Well, yeah.
Because I'm sitting here like I'd get a beer with you, bro, but no, this.
I don't know that I would anymore. I don't know that.
Yeah, no.
I think that's a red flag.
Red flag
Uh,
and a deal breaker.
Yes.
Oh, yeah.
Wow.
Chat GPT. I'm gonna let you know there are criers out there.
Wow.
Let's add that to his repertoire.
Well, but I mean, you guys, we do what we do, and we spend the hours that we do, especially in December, working with these people. So the good, the bad, and the crazy, we're here for it.
I love it. I
do
love
too.
it.
Yeah.
You know?
I do. Yeah. I wouldn't want to do anything else.
The OR is my favorite place to be, and I stand behind that 100%,
Yeah.
regardless of how weird the day may be.
Yeah.
So
Yeah. Well, cheers, guys. Cheers. Happy
Cheers.
birthday.
Thank you. Thank you.
Yeah.
And
Cheers to
on to another
OR.
3 days.
On to another 3 days or 2 weeks. We'll see. All right. Till
I don't
next
know
time.
if that picked up, but Beth's eye just twitched.
Oh, God, you guys. So bad.
Thanks for tuning in to Joint Effort PAs. If you enjoyed this episode, be sure to subscribe, leave a review, and share it with a fellow PA or med-minded friend. You can also follow us on Instagram at Joint Effort PAs for updates and extra content. See you next time.